Hello and welcome to the course titled If I Must Die, Public Health, Power, and Palestine. Thank you for being here and learning alongside us. As we pivot from the foundations of Israeli settler colonial domination of Palestine to the implications of that domination for embodied health, this week we'll explore control over the physical body. We will learn how Israel's regime of military, interpersonal, judicial, and extrajudicial control creates the conditions for unhealthy and unsafe lives, not merely from cradle to grave, but even before conception and after death. In this week, we cover themes of reproductive rights and justice, biopolitics and political determinants of health, respectful maternity care and racial separation, demography of marriage, and necropenology. The paper by Hamayel and colleagues uses qualitative methods to explore the unique context of East Jerusalem, where the separation wall, checkpoints, ID cards, curfews, and a host of other challenges impair access to antenatal care, create often fatal delays in access to safe delivery, and often make it impossible for men to witness the birth of their own children. Daoud and colleagues move us to Israel proper, where official policies supposedly prohibit racial maternal separation of birthing mothers into separate maternity wards based on race, class, or religiosity. Yet we examine the reality that those exact forms of separation still emerge. Under the guise of honoring choice and personal preferences of mothers, Palestinian birthing mothers end up being confined to separate and unequal maternity wards, particularly those with religious appearances. Having explored how structural violence and apartheid begins well before birth, we then will move post-mortem conditions with a paper on necropenology by our guest speaker for the week, Nadera Shalhoub-Kevorkian. Dr. Shalhoub-Kevorkian is perhaps the most important scholar in the world, because what could be more illustrative of a regime bent on terror, violence, humiliation, and eventual displacement than the willful denial of the basic right to bury your murdered child in accordance with your own cultural and religious traditions. Shalhoub-Kevorkian's interview with 11 bereaved families are a gut-wrenching exploration of trauma, of uncertainty, and of humiliation. Families feel frozen in time, often unsure of whether their child is truly dead or merely disappeared. Her work was so powerful, in fact, that in 2024, she was arrested and forced to resign her professorship at Hebrew University. Finally, Yara Jarallah's demographic study of marriage in Palestine and Lebanon explores how conflict shapes every aspect of the conditions of marriage. Jarallah's research took place during the recurrent violence of the First Intifada from 1987 to 1993 and found complex effects of conflict on marriage. But we speculate on how the overwhelming violence and starvation inflicted on Gaza since 7th October 2023 may have affected the timing and conditions of marriage. Taking all these mechanisms together, it should come as no surprise that births in Gaza suffered a 40% decline between 2023 and 2026, which is nearly without historical precedent. This course and website is brought to you by the Health Not Punishment Collective. As always, please feel free to utilize any of the course material for your self-guided learning or classroom setting, whether you are a student, professor, or unaffiliated with academia or public health. We believe these course materials should be accessible and shared openly with anyone who wishes to learn. If you would like to support, give us feedback, or anything about what we're working on, give us some comments on social media. We're on Instagram at healthnotpunishment_LA.